I'll be your host. I'm Christine, founder and CEO of Patient Orator. Today, we will be discussing fighting medical debt with Priscilla Keith of RIP Medical Debt. Priscilla, please introduce yourself to our audience.
Thank you so much, Christine, for having me here again. My name is Priscilla Keith, and I'm currently the Director of Program Management for RIP Medical Debt. And just a little bit about RIP Medical Debt. We are a 501c3 nonprofit organization that was organized in 2014. The mission of RIP Medical Debt is to help those who are in need to abolish their medical debt. And we do that, we look at the criteria with regard to abolishing the medical debt. And we look specifically for those patients who are 200% below the federal poverty level, who are spending 5% of their gross income on medical debt. And thirdly, look for those patients who are on the verge of insolvency or their liabilities obviously are greater than their assets. And so this is an organization that is really aligned with helping to abolish medical debt, which is a huge issue here in the United States.
Can you talk about what that process looks like and how RIP Medical Debt chooses the patients that they will essentially abolish their debt?
To give you just a little bit of a background in terms of the process, Christine, we are able to abolish the medical debt because we do one of two things. First, we either buy the debt from a secondary debt buyer. This is an organization or a person who buys the debt from a hospital after the hospital has gone through its process of trying to collect the debt and through no fault of its own and or the patient is unable to collect the debt. Or we, which we've most recently done, is to start buying the debt, and we'd like for hospitals to donate the debt, but if they're unable to buy the debt directly from the provider. That could be the hospital or primary care physician. But those are one of two ways that we do that. And in order to do that, we are funded by donors who like our mission and contribute to that.
How can patients leverage RIP Medical Debt if they're experiencing medical debt or financial difficulties during this time?
I would advise patients to go on RIP's website. We do have a place where people can go in and download, specifically as we've just dealt with COVID, in terms of a survival guide for how to deal with the coronavirus. And it articulates some of the same things that we've talked about here in terms of how do you manage your medical debt? What are some of the questions that you should ask with regard to your medical debt? Asking those questions, what are some of the programs that you may want to take a look at? Again, looking at your, not being afraid to look at your hospital billing. And so we do provide that. We also provide a list of resources, and there are certainly organizations who do this much better than RIP. Our mission is to abolish the debt, but there are organizations across the country who work with patients with regard to consumer debt, how to bring down your consumer debt, what are the processes with regard to dealing with that. We don't endorse anyone, but we certainly have a listing of those organizations that are reputable and that the patients can go through and take a look at. So we do have some things online, and we're also looking to see how do we partner with those organizations that do it far better than RIP can do to really educate people about debt and specifically medical debt and its impact. And so it's not only people, but it's also organizations as well.
Let's switch gears here a little bit. As it relates to patient advocacy, what can patients do to advocate for themselves as it relates to medical debt?
Understand what's in your bill, because oftentimes we get the bill, We don't read the bill. We're just assuming that what's in the bill is accurate. And so you need to go through the bill and check to see whether or not you've received some of the charges. Because sometimes, as with most things, there are errors. And so you need to understand and look within your bill, particularly if it's been an extended stay in a hospital, understand what that is going forward. And if you have questions about it, you are allowed, it is within your right to call that provider to ask about the billing. And if you have insurance, again, I would say understand what type of insurance you have, what's the plan that you have. Sometimes we do have insurance and we don't understand particularly what the benefits are. So I would say if you do have insurance, reach out to your insurance company to understand the type of insurance you have, what your deductibles are, and then what you are required to pay once all of that is met. If you can't pay the bill, don't ignore it. Pick up the phone and call the provider, because the hospitals usually have a financial assistance policy and or charity care that they can look at. And if you qualify under the conditions or requirements that they've set out, and remember, each hospital is different in terms of their financial assistance policies. That's the one thing that you can do to say, listen, I've received this bill. I'm unable to pay this bill. What are some of the programs that you have that I may qualify for? You look at the financial assistance policy. You then look to say, do I qualify for Medicaid or Medicare? Because you may not know the requirements for that, but you ask about that. And some hospitals have programs in which they will help you with that particular process. I would also advise the patient, you may not be able to pay the bill all in one lump sum, but ask the hospital if you can get on an interest-free payment plan. Some of those do allow that, and if you don't ask, you won't know. So you ask about that. And if it gets to the point where it has been turned over to a collection agency, then you ask those same questions to the collection agency in terms of, I've gotten this bill, I've received a letter from you, I cannot pay all at one time, but what can we do together in terms of a payment plan in order to pay this bill in full? So those are some of the steps that I would advise patients to do.
Thank you, Priscilla. I'm curious to know what kind of safety policies are currently in place to help patients navigate medical debt.
The financial assistance policy and or charity care policies, most of your non-for-profit, if not all, are required by law to have those policies and post those policies online so that patients can see exactly what those policies are. And so those policies do set the tone for the patient in terms of what are the requirements that are needed to be met in order to qualify for assistance. And the one thing that patients should always ask is, can you tell me about your financial assistance policy? Here's what's actually going on with me. Because sometimes when the patient has received services from the hospital, that patient may have been employed, may have not had an issue with paying their bills. But for life, and we know that life happens, in between receiving those services and getting the bill, the patient may become unemployed. And so you may not think about the financial assistance policy or the charity care, but call and ask about those. Ask and let the hospital know, the primary care physician, let them know exactly what's happening, because that means that you've fallen through, I won't say the cracks, but it may not have been applicable to you at the time you received those services, but it's now applicable given that you've received the bill. So I know the patient is worried, they're anxious, they're stressed, because in there, they may be thinking, if I don't pay this bill, something else may happen to me and I may not be able to go to the hospital because I have this bill looming, and I may not receive the care because I have the bill. And so that gets to your access of care issues. And we certainly don't want the patient not to visit the hospital or to not receive the care. That's why it's vitally important, even if the patient is anxious, is stressed, to call the hospital, call the physician's office to say, I cannot pay this bill at this time. What are some of the avenues that I can take to pay that bill, particularly with the hospital and their assistance policies? That's really meant to help meet this need with the patient.
Do you have any advice for patients to be empowered even in such circumstances?
Healthcare is really a very complex organization. It's a complex system. And even those who work in healthcare say that it's complex and have issues navigating it. What I would say to those patients who are anxious about the bill, or just in terms of about the process, is to take the first step to understand exactly what type of treatment you are receiving. Ask the questions about when you go to receive your care, to ask, what type of care am I receiving? What is the cost of this care that I'm receiving? Because in the past, physicians or the healthcare provider would come in, give a recommendation, and we would go with that. But now I think people are better advocates because they ask questions about what's actually happening here. What is the treatment? What is the cost? Is there a different type of treatment that's lesser in cost? Because you do have to ask that. You don't have to necessarily get what we would call the Cadillac service to resolve a medical issue. And so just asking those questions at the beginning with regard to the service, I think is important. I think secondly, we do look at surprise billing. And I think sometimes patients, when they go to the emergency room, will get a bill, and they'll get a bill from the hospital, but then they also get a bill from the provider who is providing the treatment in the hospital, but not necessarily bundled. And so they need to ask the questions with regard to that, with regard to the type of services and who's giving them the services. And then I think thirdly, and most importantly, again, is asking about those particular programs that the hospitals have to offer with regard to helping them to pay their medical bills. Suffice it to say, how patients become empowered is asking those questions, not to be afraid with regard to their treatment plan, and what the cost is for their treatment. One thing too, I would say, Kirsten, is that sometimes when you have a person who's a patient who is receiving information, sometimes it's hospitals do have patient navigators who are there to assist the patient through the process and to be able to ask those questions that the patient may not be able to ask because they're receiving information and they're trying to process the information that they have. So you may have a navigator, or you may have just a person that could be a relative or a close friend to help you ask those questions that you may not be thinking about at that present time because you're trying to process what the healthcare provider is telling you. So it's extremely important, depending upon what's actually happening, to reach out to ask someone that you trust to come with you, because that person may be able to ask those questions that need to be answered by the healthcare provider in a safe zone.
Thank you so much for being here, Priscilla. I appreciate your time and expertise and the information that you have shared with our viewers. Have a great day.
Appreciate it.